Good afternoon and welcome to the Living Well radio program. You can find us here every Wednesday at 1 p.m. on KATB 89.3 in Anchorage as well as KJLP 88.9 in Palmer. You can also catch us online at katb.org. My name is Cammie and I am here once again with my co-host Betty. Always a pleasure to be in the studio with you, Betty.
Yes, it is. It's always a lot of fun.
We have way too much fun, don't we? Messing things up in here.
Messing things up. We do that well.
Yes, we do.
Hey, should we tell everybody we've had a selfie stick in the studio today?
Oh my goodness, we are getting so high tech, aren't we?
Except we can't figure out how to make it work.
We're going to have to ask Shaylee.
Yes, she could probably tell us. She's
Definitely
what, 8, 9?
Yeah.
Oh, yeah.
We are so thrilled to be in here today, again joined by Alice Baum, who is a licensed professional counselor at Cornerstone Counseling. And we had her on last week and just couldn't quite fit it all in. So we are so excited that you're willing to be back with us for part 2. I want to, Betty, you have a message first. You want to ask all the ladies to do something who are listening. What is that?
That's right, Cammie. I'm glad you mentioned that. I'm going to encourage everyone to get a pen and paper, because you're going to want to write down some of the suggestions that Alice is going to give us and some comments she's going to make you're going to want to remember. So run right now, get a pen and a piece of paper. I just got mine out so I can take some notes too.
Yeah, because last week you were scrambling
Yes.
for a napkin or something
Something to
jot
write
some
out.
things
I was
down.
looking for anything to write some things down. But I've got my pen now.
Excellent. We are all set. We want to get started today by just asking you, if you don't mind, Alice, to recap a little bit about what we talked about last week. What is depression? And just kind of summarize that for us before we jump into starting to talk about anxiety today.
Okay, I will be happy to. Depression is a common but a serious mood disorder. It causes severe symptoms that affect how you feel and you think, and just how to handle your daily life activities, such as sleeping, eating, and working. And so to be diagnosed with a major depression, you would need to have these symptoms 2 consecutive weeks.
Okay, that's good to know.
Mm-hmm.
Alice, why is it that it seems depression affects women more than men?
Well, it does, and I don't think we're going to be at all surprised why once I give that to you, but it's really true that that depression affects us more. It actually is twice as common in women as in men, and at least 20% of the women are going to experience at least one depressive state in their lifetime, and sometimes even more. But there are some reasons why it's more prevalent in us women. First of all, we have biological reasons. So women have a stronger genetic disposition to developing depression than men do. Women we're also blessed, I guess, with these fluctuating hormones that
What a blessing.
Is this when we break into song?
Yeah, we start singing now.
Okay, but
Betty
yes, we have such fluctuating hormones, and then in life events they fluctuate even more. So this can also lead us right into depression. There's also psychological explanations. Women are more ruminative than men. We tend to think more about things more than men do. We have it go over and over and over in our mind, and those thoughts sometimes get us in trouble and get us into depression. And women are all about relationships, aren't we?
Yes.
And relationship problems are likely to affect us women more than it affects the men. So, and then there are sociocultural reasons. Women come under stress more than men do. Not only do we have to work, but just like the men, but we also are expected to bear the brunt of household duties and bringing up children and caring for our older relatives. And then studies show that women live longer than men. And so that's kind of an obvious one. But extreme old age is often associated with bereavement, with loneliness, with illnesses and diseases. and so we end up depressed. And then lastly, us women are more likely to seek a diagnosis when we're feeling these things. And so we're more likely to go to a doctor or to a therapist and to find out what is wrong with us.
If I have a friend, or let's say a loved one, a daughter or an aunt or whatever, are there things that I could do to help them with their depression?
Yes, you sure can. Supporting them, encouraging them. Sometimes they may need you just to be near, just to sit with them, talk to her or him and listen carefully. One of the things I tell people is to be patient with those who are depressed. It's as much frustrating on the people who are trying to help, but it is really frustrating for the depressed person because you feel like you are going crazy. And so that patience is vital. And never ignore, Betty, the comments that anyone would make talking about suicide. If you hear someone talking about suicide, you need to tell someone. Tell one of their family members. Encourage that person to go to their therapist, or if it's after hours, to go to the emergency room at one of the hospitals. But don't ever ignore talk about suicide. And then you can just invite her out for a walk or out for coffee and just talk to her. One of the things that we want so much when we're depressed is to be normal and do normal things. It feels like we haven't in a long time. So inviting her out to have coffee or for a walk would be just lovely. And remind him or her that the time and after time and treatment, the depression will lift.
I'm so glad you brought up, you mentioned suicide. I have been amazed in talking with women, especially young adult women, how many have suicidal tendencies in their mind, and they think about it. And I was completely caught off guard by that. I had no idea. So I'm very glad you brought that up. And is there anything else that you, we're going to go to another topic, but is there anything else that you would want to tell the women that are listening about depression?
Well, I think what I would like to tell them is if you know someone in a crisis or you are in a crisis, that you need to tell someone. You need to call your doctor or your therapist, call 911, go to the nearest emergency room. Then I'm going to give you a phone number to the National Suicide Prevention Lifeline. But they're open 24 hours a day. It's toll-free. It doesn't cost you anything. But it's 1-800-273-8255.
Alice, can I ask you one thing? I mean, does talking really help? Like when you're going through a crisis, when your circumstances are changing dramatically, how much does it help just to talk to a trusted friend?
Oh, it's very cathartic to talk to someone. When you're talking to that trusted friend, you all of a sudden have this sense of somebody understands me. Somebody is here for me. They're pulling for me. They're encouraging me. And oftentimes that's just the hope that someone needs at a time like that.
So one of the things that we as women, I mean, we love to talk. We need to take the time to listen as well. In order to maybe help our fellow sisters or even our family members. Just take the time to listen to what they have to say.
So as we move into discussing anxiety, Alice, what would you say about when we have stress or anxiety symptoms? Does that mean that we have an actual anxiety disorder and that we're going to begin to experience having panic attacks?
Well, panic attacks are serious medical illnesses that affect, get this, 19 million Americans, adults. That is a lot. And it's important to know the difference between a normal emotion of anxiety and panic attacks, because sometimes we use those words interchangeably, but they do have different features. anxiety and stress is a normal human emotion. And we experience anxiety or nervousness when we're faced with a problem or we're making some important decision. And stress is our response to a change in our environment. You know, you hear people all the time saying, I'm stressed out, I'm stressed out. Sometimes I don't think they use the word the correct way because it seems like that's a big buzzword now. We're all stressed. But stress is a response to a change in our environment, whether it's a good change, a positive change, or whether it's a negative change. But see, God designed our bodies to react to change. You know, falling in love, starting a new job, or suffering an unexpected loss. And so we're created to react physically, mentally, and have emotional responses. So it's good to know that we don't all act and we don't all react to stress the same way. Sometimes that's a source of, a source of a negative stress for one person, such as a deadline, might not be a negative stress for another one. It might actually be a helpful expressed anxiety. I always work better under pressure. So, what may cause you anxiety for procrastinating actually causes me to work better. So first we have to realize that we're all different and we all react to stress differently. Second of all, stress and anxiety and panic attacks are not the same, although they both have some similarities. They do have some features that are the same, and they cause the physical and the emotional distress that, of course, end up interfering with a person's life and normal life for them. The difference between the panic and anxiety, and Cammie, this is I'm where you're wanted to know here. The difference between panic and anxiety are best described in terms of the intensity of the symptoms and the length of time the symptom occurs.
Interesting, very interesting. So what I hear you saying is we're all going to experience some sense of or some sort of anxiety on a daily basis just because, or maybe stress. Is that the better way to say that? Not necessarily anxiety, but when it's continual or lasting is when it's crossing the line to being something that needs to be dealt with.
That's right. And not only that, when it starts changing our lifestyle, when we can no longer do the things that we normally do because of the anxiety, then we know that it's a problem.
Does anxiety affect women more than men, like depression does?
Yes, it sure does.
For the same reasons that you gave earlier?
Pretty much the same reasons it affects women more.
I know years ago, every time I would fly, at some part, usually before we landed on the plane, I could feel myself. I would start breaking out in a sweat. My heart would start beating, and I actually, this was so embarrassing, I passed out twice on a plane.
Really?
Wow.
And they wanted to even land the plane. I was mortified. But the doctor told me it was panic attacks. And I thought, I'd never heard of such a thing happening like that. And it became to where I would be fearful of flying. Thankfully, that all passed. I mean, I had no idea what happened, but now I fly. And so, Cammie, if you ever fly with me.
Thanks for the heads up on that.
Carry some smelling sauce. You were asking about women and how much it affects us. It says studies show that women are more likely than men to have an anxiety disorder. And approximately twice as many women than men suffer from panic disorder, PTSD, generalized anxiety disorder, agoraphobia, and other specific phobias.
What I think is interesting for me is I often wonder if the overwhelmness of just my season of life, raising 3 children, I do work, I get to work from home, which I don't know if that's a benefit or a more trouble than a benefit sometimes. But it's difficult to know what is just a normal overwhelmness for that season of life versus what might not be so normal.
Again, it's the frequency and the intensity and how it affects your daily living.
That's the difference.
Yes, yes. When it's a season of life when we're working at home and things are just chaotic, you're possibly not going to make yourself a hermit. You're not going to, have some reactions to it in an extreme way. If you're used to going outside and walking around the block with the kids, you may, if it starts becoming unhealthy anxiety, you might want to start staying in and not going outside. Something is going to change in your normal daily activity that's going to give you a clue that this is going over the top.
Interesting. That's good to know. That's a good guideline to use.
Mm-hmm.
How do you diagnose anxiety? Just by talking to your clients, to your patients?
Mm-hmm. Well, anxiety, we give an assessment to our clients, a test to again measure that intensity and frequency of what is going on in that person's life. And we like to send folks to doctors to make sure that it's not medication induced. A lot of medications cause us anxiety. A lot of cold medications, those things can cause us.
Really?
Mm-hmm. Get jittery. You might start having anxiety. And then we have, a list of how we diagnose anxiety disorders. Now, you were asking what the causes are, or how is it diagnosed?
How's it diagnosed?
Okay, yeah. And so we do the assessments just to find out what that intensity is, what is their daily living like, and has that changed, and the frequency, how long has this been going on. Our manual for diagnosing, it says these are the characteristics for anxiety or for a panic attack if you're having one of those. Heart palpitations, your heart starts pounding. You have this accelerated heart rate. Excessive sweating, trembling or shaking, sensations of shortness of breath, feeling like you're choking. Now, these are all panic attacks if you're having a panic attack. Chest pain or discomfort, nausea, feeling dizzy, unsteady, lightheaded, or faint, feelings of unreality or being detached from oneself, fear of losing control or going crazy, fear of dying, a numbness and tingling sensations, chills or hot flashes. And so all of these symptoms can be quite frightening when they're happening to you, but you must remember that they will stop. And after you've completed your panic attack, you're going to feel stressed out probably the rest of the day. You're going to feel keyed up the rest of the day. I'd like to take a moment and kind of give us a biology lesson on how this all works. And so if we're in an anxious situation, God has given us what is called our fight or flight, and now I hear freeze, a reaction that we can have towards danger or something that's going to stress us out. And so when we are fed, like the cavemen, when they came out of the cave every day, they didn't know if they were going to meet up with an angry lion that's going to chase him for, he was going to be the food, or if he was going to chase the lion for the food. And so that triggers anxiety, which then triggers this fight or flight or freeze reaction. So when all that happens in our brain, we have what is called an amygdala. The amygdala, it houses some brain hormones and chemicals. So when we hit that fight or flight part, amygdala says danger, danger, because there's a problem in our body that we're afraid of something. So it begins dropping chemicals in our body to make our heart race, to make our blood pressure go up. It makes our hands sweaty. All those things that I just told you about, these are fight and flight reactions because you have got to either fight a bear or run from a bear, you know. And so at the same time, what is happening is your amygdala sends a message to your prefrontal cortex, right in the front of your head, right near your forehead. That is the place where we make good decisions, where we are rational, we're logical. This is where that is all housed in that prefrontal cortex. The message to the prefrontal cortex is stop. So all activity stops when you are in fight or flight, because you certainly don't want that to keep going if you're standing in front of a hungry bear or a lion going, oh, well, I wonder what I should do. Oh, well, you know, I need to think about dinner before I get going here. You know, you don't do that because your body is in high alert. Your body is in fight or flight. So when this is happening, you're no longer thinking logically. So think about a time when you were anxious, and you know, if you maybe you said or did something not too smart, well, that is why, because your prefrontal cortex has been shut down. So how to get your body to return to a balanced state is by breathing. You need to breathe. You need to do slow breaths in through your nose and out through your mouth, holding about 4 seconds each time. And what that does, when the oxygen gets to the brain, then it calms everything down. Your body goes off of high alert. And then what's happened to all those chemicals in your body? They're just there. They're just there. Scientists are finding that that's why we're having trouble with anxiety, is because back in the caveman days, they ran everywhere they went. They exercised. They were on the go all the time, and we're not. We're more sedentary Americans. And so what we need to do is exercise. Exercise, exercise, exercise. That is one of the best things you can do when you are an anxious person, or if you've been diagnosed with an anxiety disorder.
That leads me to a question, Alice. I want to ask you, how do you make that determination between whether or not somebody just needs to implement some of these healthier habits in their life, digging into God's Word, exercising, eating right, versus needing a medication to help them through anxiety or depression?
Well, I think a lot of it depends on the severity of their anxiety. If they are suicidal, if they are having panic attacks almost on a daily basis, if they have gotten to a point where they are not sleeping, or they're so anxious that they can't go to work, then it's probably a good time for them to talk to their doctors about medication, because that will help them get to a place to where they can do these things that they are having trouble doing now.
Would you say that medications should be used for a season versus, or are there times where they really need to be a long-term solution?
Well, everyone is different, but I think for the average person who is not suffering from severe anxiety, if they are on medication, it probably should just be for a season. I have read many books and articles about anxiety, and the person I really like to pull from, he recommends that anxiety medicine is for a season. And when you're on it, you need to be in talk therapy, talking to someone, figuring out why are these things causing you such anxiety, and then work on tapering off of the anxiety medicine.
That makes sense.
Are there supplements that you can take to reduce anxiety? Just like you gave us a list of supplements for depression.
I'm sure there are, but I did not bring a list today. But I know there are supplements that you can take. I'm thinking there's something, a root, that you can take, but I know that's not very helpful.
Do you have the list handy for the supplements you gave us for depression?
Yes.
So that the ladies might, if they have their ink pen, because I forgot to write them down, and I remember one was.
I have them, Betty.
You
can
have them?
borrow my notes.
One was fish oil, I remember, and one was
Yes.
vitamin D.
And B complex.
B complexes, and there was one
I think
more.
I missed one of the
Okay,
others.
so yes, you're right. You're almost made 100 here. So there's fish oil, and there's B complex vitamins. There's 5-HTP.
HTP.
There's theanine,
Okay.
and that's THEANINE.
Okay.
And then, of course, vitamin D.
So would you take all of those together or just pick one and try it and see if it's
I think they all come together.
okay?
When I got some supplements, I walked out with all of these.
Okay.
Now
That's
with
one of
this-
the most confusing things about vitamins
know.
is knowing which ones to take.
Right.
So
With the sunshine, hopefully we're going to have summer this year.
Yes,
If you're out in the sun, do you still have to take your vitamin D?
absolutely. Us women need to always take our vitamin D.
good question.
One more thing I wanted to add about the medications. They use antidepressant medications along with anxiety medications quite often. And but what I want to caution people about is that if you choose to go on meds, but if you do choose to go on meds, you need to talk to your doctor and understand what med you're on. Psychotropic medications can be addicting. And so you want to understand all of the side effects. You want to understand, you want your doctor to help you understand how long you're going to be on each of these medications. And of course, again, if it's an addicting medication, you do not want to become addicted to these, to any drug, any medication.
I want to ask you, just in our last few minutes of closing, and you can ask an additional question if you have one, Betty, too, but how accessible is counseling to people? Do you have to have insurance? What does somebody do if they don't have insurance? Is it a high cost? Tell us a little bit about what you know about that, Alice.
I think counseling is very accessible to people. If you have insurance, it is going to cost you a lot less up front, because counseling can be expensive. And so in our clinic, we do take all forms of insurance except Medicare. We do not take Medicare, and it's there's a reason,
Sure.
not just because we don't want to take it, but there is a reason why we can't. You pay a copay, and you get counseling. There are counseling centers, and these are becoming more and more popular, that are cash only. But what they do is they then give you a super bill, and you can send it to your insurance company and be reimbursed. But there's some parts and pieces that you have to check on before then.
Alice, thank you so much for being with us. Would it be okay if we come across women that are in need of counseling that we gave them your name? Could we refer them to you at Cornerstone?
Oh, you bet.
So would you again give us the phone number
Yes.
of how they can contact you?
Yes, you can call and talk to our receptionist at Cornerstone Clinic, and our number is 522-7080.
And then can they ask for you?
Yes, they sure can.
Okay. Alice, thank you so much for being with us. It took us at least 4 months to make this happen, but it was worth the wait.
Well, thank
We
you.
appreciate you being here so much. Thank you.
Thank you.
Thank you so much for joining us today on Living Well. You can catch us here every Wednesday at 1 p.m. on KATB 89.3 in Anchorage, as well as KJLP 88.9 in Palmer. You can also listen to us online at katb.org. We'll see you next Wednesday.